My name is Gabrielle, and I will be presenting on public health during the Victorian Age. I want to give a little bit of an overview as to what public health is before really diving into this presentation. So I pulled this definition from the Center for Disease Control and Prevention website. The CDC is a public health agency in the United States. There are equivalent agencies in the UK and in England, such as the National Health Service and Public Health England. I just chose the CDC definition in particular because it's broad and I feel like it speaks to what public health is very well. So public health is the science and art of preventing disease, prolonging life, and promoting health through the organized efforts and informed choices of society, organizations, public and private communities, and individuals. Due to new scientific discoveries, coupled with emergent cultural awareness of health crises, the Victorian period marked a defining era in the development of the modern field of public health, exemplified by new ways of advocacy through which institutions were challenged for their role in precipitating public health crises. So let's take this central theme and break it down. I'm just going to leave this up on the screen for a moment longer so you can really digest this. Why in particular was it a defining era? Well, during the Victorian Age, legislation that was originally passed with the intention of social reform aimed at addressing the byproducts of the Industrial Revolution had a precipitating influence on Victorian health. And this was because of the strong relationship between urbanization, overcrowding, and poverty and disease that existed on an unprecedented scale during the Victorian Age. Industrialization brought a lot of new problems, and it called for new innovative solutions and approaches to solving these problems and also new ways of advocacy. So the first Victorian health reformers were these social reformers, social commentators, and politicians such as Edwin Chadwick, Charles Dickens, and Benjamin Disraeli, also Frederick Ingalls. And then doctors and nurses and scientists became public advocates for improved urban infrastructure and healthcare and medical care. And the Victorian Age was such a defining era for the field of public health, as new scientific evidence replaced antiquated thought at a time when people were uniquely receptive to new theories due to a climate of concern created by Victorian social commentators. So this last point we'll address throughout the presentation. The science of modern epidemiology has its very origins in the Victorian Age, and the great movers and shakers of the Victorian Age, these thinkers who thought outside of the box, who looked at health problems through new quantitative measures, who conducted these immense, qualitative studies, they have actually just really shaped the field of public health care, and we can see that their methods are really present in the way that we look at things today. The Victorian Age was just absolutely riddled with disease. Middle-class men had an average lifespan of 45. If they got that lucky, laborers had a lifespan of about half because of workplace injuries and workplace conditions, high infant mortality and child mortality rates, rampant epidemics of smallpox, tuberculosis, typhoid, influenza, typhus, and cholera. In his report on the sanitary condition of the laboring population of Great Britain, Edwin Chadwick included figures to show that in 1839, for every person who died of old age or violence, 8 died of a specific disease. I included a cartoon in the corner of this slide that was published in Punch magazine in 1858. And this cartoon was published during a period known as the Great Stink. And the Great Stink happened when there was very warm weather in London, and the large deposits of raw sewage in the river caused the river to smell just so bad that the Houses of Parliament actually had to be closed down for a few weeks. They didn't even meet. But this cartoon depicts 3 diseases, and these diseases are being shown as coming from the river, as being waterborne. And this is a little bit inaccurate because diphtheria and scrofula are not waterborne diseases, but this cartoon illustrates an acceptance of the theory that diseases could be spread through waterways, and it really shows acceptance of the theory. And I decided to include this image at the beginning of my PowerPoint because I feel like it embodies all aspects of the central theme that I will be tracking through this presentation, because this image demonstrates a cultural awareness of the health crises that were going on at the time. It also shows a new scientific theory, the fact that these diseases were waterborne. It shows how art and literature influence public opinions and put pressure on legislators. And this kind of cartoon was a new form of public health advocacy. So we'll be going through different examples like this throughout the PowerPoint. Pushed for better living conditions for city dwellers on an unprecedented scale because they were armed with revolutionary evidence linking poverty to disease. And this would change the field of public health forever, because there would be now a societal and social obligation to help the impoverished and the downtrodden in a different way, because now it wasn't just that they were struggling because of their poverty or that they were starving. They actually had and played a really big role in public health crises and disease outbreaks and such. And I know this idea sounds really simple, but it was quite revolutionary how the Victorians demonstrated this link. A huge project of urban analysis by the Benthamite social reformer Edwin Chadwick had been published as a report on the sanitary condition of the laboring population. This helped instigate what was called the sanitary movement through horrific statistics concerning life expectancy in inner cities and vivid explanations of the root causes of such problem. Chadwick's work revealed the urgency of improving water supply and drainage. I took this quote from Gage's Victorians to describe Edwin Chadwick, the first social reformer I will be covering. So Chadwick was the architect of the Poor Law of 1834, and there's some really interesting questions that came up while I was reading about him. Some research papers imply that his involvement in public health really was to reduce the cost of public relief, that's mostly what he was focused on, and that his poor laws were very, very harsh. Dickens was a critic of them, and he essentially implied that Chadwick's poor laws were just so strict and so harsh that nobody would really want to seek government relief by going to these workhouses. Edwin Chadwick did not come from a scientific background. He did not have a scientific background. He was trained as a lawyer. He was a confirmed believer in miasma theories. He was convinced that active measures such as cleaning, draining, and ventilation would make people healthier and therefore less dependent on welfare. His publication on the sanitary conditions of the laboring population used numbers to show the correlation between poor living conditions and life expectancy. This information comes from the Brought to Life Science Museum UK website. And although his theories relating to disease transmission were incorrect, his use of statistics captured the horror and magnitude of death that was relayed through literature and other forms, but he captured it in a novel way with numbers and was a very effective communicator in that sense. So I want to show you a public health timeline now to really stress the point that the reformers played such a significant role in legislation being passed. For example, Chadwick published his report on the sanitary conditions of the laboring population of Great Britain in 1842, and in 1844 the Health of Towns Association was established. 1848 the Public Health Act is passed. 1849 the Metropolitan Sanitary Association is established. Then in 1849 we see John Snow, who was a physician, writing on the mode of communication of cholera. And from there, you have more laws being passed, like the Public Health Act revision in 1858. So I just wanted to show this timeline. You could take a look to just give a broader sense of the history of public health that we're looking at. So back to how social reformers use quantitative measures in novel ways to really bring across the importance of their cause. Chadwick used the work of Dr. Robert Baker, and Robert Baker published a survey in 1833. He published a survey of Leeds, and Chadwick actually included Baker's survey in his report on the sanitary conditions of the laboring population of Great Britain, which was published in 1842. So he took this report from Baker from 1833 and published it in his work in 1842. So actually, I found an excerpt of the meeting minutes from when Dr. Robert Baker originally presented his research to the Leeds Board of Health. We are of the opinion that the streets in which malignant cholera prevailed most severely were those in which drainage was most imperfect, and that the state of general health of the inhabitants would be greatly improved and the probability of future visitation from such malignant epidemics diminished by a general and efficient system of drainage, sewerage, and paving, and the enforcement of better regulations as the cleanliness of the streets. Leeds Board of Health, meeting minutes, January 16th, 1833. So as you can see, Chadwick was really influenced by the work of Dr. Robert Baker, and when he talks about these malignant epidemics relating to systems of drainage, sewerage, and paving, the poor obviously had, infrastructure that was lacking. So from reports like this, Chadwick was able to make the connection between poor infrastructure and public health. I've included 2 additional charts of Robert Baker's works that were published in Chadwick's report on the sanitary conditions of the laboring population of Great Britain. As you can see, here are mortality charts relating to the amount of deaths and births, and also an effort to connect them back to the conditions of privies and rivers and such. So in my presentation, these charts mostly just function as examples of the quantitative measures that social reformers with no background in science, like Edwin Chadwick, used to advance their cause. I also included these charts just to show the magnitude of death due to disease, and I think the first chart is very interesting in particular because it does talk about the different conditions of privies and sanitary conditions and such, and connecting them to deaths. Back to something that I mentioned previously, that even though Chadwick used these quantitative measures, he really was not without fault. He believed that disease transmission really did come from miasmas, or bad smell, the bad smell of the sewage. And this was definitely not correct. Disease spreads from germs, from microbes, and such. So I've included a little slide on the miasma theory. So what came about from the efforts of social reformers? Well, the Public Act of 1848 was a very significant piece of legislation. I would like to read to you a little excerpt from a journal article called Revolutions in Public Health. 150 years ago, the Public Health Act for England and Wales marked the start of a commitment to proactive rather than a reactive public health, in which the state became guarantor of standards of health and environmental quality and provided the means for local government to meet those standards. The driving force behind the act, Edwin Chadwick, began inquiries into public health as a means of reducing the cost of public relief. The act that finally emerged was a stripped-down version of the original proposal and concentrated on provision of constant water supply and efficient removal of sewage. Although riddled with compromise, one is now struck by the practical wisdom and revolutionary implications of the legislation. The recent Green Paper on Public Health, Our Healthier Nation, reflects the heritage of this legislation in seeing health improvements as a process involving central government, local communities, and individuals. And I think Chadwick and Dr. Robert Baker and other social reformers, their writings, their statistics really did reflect. So the passing of the Public Health Act of 1848 was also inspired by a very horrific cholera outbreak that happened between 1847 and 1848. So again, this Public Health Act set up a central board of health as well as local boards of health, but the legislation was quite permissive, and the legislation actually didn't apply directly to London. The Central Board of Health was created, and although it was abolished 10 years later, the Act also encouraged local boards of health to be set up to appoint a medical officer, provide sewers, inspect lodging houses, and check food which was offered for sale. This quote comes from the BBC. So the image that I included in the corner of the slide is a notice of the passing of the Public Health Act in a town in Lancashire. And it's actually signed by the medical officer appointed to that town. I can make out his first name, Robert. He signed the bottom corner of the notice. And the notice reads, whereas in pursuance of the Public Health Act 1848, the General Board of Health have directed Robert, Esquire, one of the superintending inspectors appointed for the purpose of the said act, to visit and there to make public inquiry and examine witnesses with respect to matters following, that is to say, the sewerage, drainage and supply of water, the state of burial grounds, the number and sanitary conditions of inhabitants. So again, Chadwick was instrumental in helping pass the Public Health Act.